Turning to Utah's COVID-19 numbers, state health officials say more than 2,100 Utahns have now tested positive for the virus. And for the very first time here, the positive test rate per day climbed above 30%. That is the 9th highest COVID-19 positivity rate in the country. And it's part of the reason why the Utah Department of Health is expanding free testing all around the state. News specialist Matt Rascone has more on this push to find those with COVID-19. Matt, what'd you find?
Yeah, 24 locations around the state where you can now get a free antigen test. It's fast, and it's all part of the state's effort to slow the spread of COVID.
If you want to get tested, go get tested.
That's about all it takes to get tested for COVID these days.
There's a lot to do, and there's a lot still to be done.
As the state faces a 7-day positive test rate of more than 30%, the highest rate we've seen since the start of the pandemic.
There's a good likelihood that there are people out there who are actually positive for COVID but haven't been tested and don't know they're positive. And so they're actually spreading the virus to other people.
Charla Haley with the Department of Health says their goal is to more quickly identify people infected with COVID, including those who don't have symptoms.
If they don't know they're positive with COVID, they won't take the extra precautions and stay away from people like we need them to.
This drive-through clinic at the Utah State Fair Park is one of 24 clinics in hotspot areas around the state, offering free rapid antigen tests with results in less than a half hour. It's a big effort.
There's so many moving pieces to this.
Considering the state's focus on the vaccine, the latest numbers show Utah has administered more than 48,000 doses of the vaccine, or about a third of the amount that has been shipped here.
It's been a challenge to try and keep up and make sure that we're dotting all the I's and crossing all the T's.
An important note, rapid antigen tests are not as effective as the typical PCR test that we've all become accustomed to. For that reason, health officials say if you test negative but have symptoms, or test positive and don't have symptoms, they say you should still get that other test. Mike?
All right, good information there. Matt Rascone live for us this evening in Salt Lake. Matt, thank you.